have developed this 7-pronged approach to living with the psychological side of cancer.
Yes.
And the big C, Reattitude's philosophy is what it is. Tell us about the 7-pronged approach. Sounds fascinating.
Yeah, so you know about the Beatitudes, right? So it was sort of coined from that term. But the big C Beatitudes, the big C meaning cancer, it's 7-pronged, and it's really designed to address the invisible tumor. So the invisible tumor is the opposite from the physical tumor, right? So the physical tumor is the cancer. We're addressing that with treatment. But what are we doing about the psychological tumor that is growing while we're treating, or even before? Once the patient is diagnosed, everything changes.
Is there truth that, a lot of times you hear, if you have an illness like cancer, what have you, if your psychological being is down and negative and not hopeful, it can actually make things worse?
Absolutely. And there's studies that actually show this to be true, but also it decreases the patient's compliance. So on a practical level, compliance is decreased, or the patient may just not complete treatment because their psychological state is not being replenished, right? The hope is not being replenished.
It's like a block.
Exactly. And so in my years of practice, I have observed this in my patients. And so I developed the Big C Reattitudes to address just that. And so the acronym is HIS LAMP, right? And the Re for the Reattitudes is actually the infusion of the elements of the Reattitude. So hope is the restoration of hope. So that's the H, right? The I is identity. So the reclamation of identity. The S is self-worth or self-esteem. Self-worth, for example, patients who undergo mastectomy many times, they sense that they have lost some of their self-esteem, right? So it's the reaffirmation of self-worth. L is the reappraisal of life, where facing your mortality, it really prompts you to reappraise what life is all about. What does life mean to you now that you're facing mortality? Because it's very different, right? And then A is requited admiration. So requited, meaning they admire me, and they've expressed that multiple times. They admire their physicians for what they do. But requited, I admire my patients for the strength, the tenacity, the courage it takes to go through what they go through, right? Because honestly, they're waking up every single day knowing their diagnosis. And many times I really believe that when they're diagnosed, they're waking up thinking this was a dream, only to find out, because we all go through that. We have a nightmare and we wake up and we say, oh, thank God that was a dream, right? But for them, it's the reality, right? And so it takes a lot to go through what they do. And I need to remind them that, because they don't see themselves, that's why they need a mirror. We don't see ourselves, that's why we need a mirror, right? I'm their mirror. I'm seeing what they're going through. They're not really taking stock of their own courage, of their own resilience, what it takes for them to go through all this. So I remind them of that. I admire them, and I learn from them.
And they're afraid to even look in the mirror sometimes.
They are, and it's, as I mentioned, I alluded to mastectomy, etc., right? And the M is the rehabilitation of the mind. So when the mind is is corroded by hopelessness, right, then I need to rehabilitate the mind where now they can see a future. Even if the illness is terminal, there are ways that I can coach my patients to actually see a light, right, and also to appreciate life, and not only that, but to prime them to leave what I call a legacy. So you can will all that you've learned from this process of life, you can will it. And I say will meaning, an actual will. You can will it to your grandkids, your children, etc. And then the P is for purpose, and that is the reignition of purpose. And I always use this reference. I did not treat her, so I can't take any credit for this. But Claire, she is the CEO of Feeding America, and she mentioned she mentions on her website. I had the pleasure of meeting her, and she mentioned on her website that she was a big Wall Street mogul. I mean, then she was diagnosed with cancer and breast cancer, and everything changed. And that is how she became the CEO of Feeding America. And the thing is, when she was a child, this was her goal. She always knew that she wanted to be a philanthropist, someone who helped others around the world, but she forgot about it because, see, the culture, right? The word cult is in culture for a reason. Even we don't think we're a part of a cult, but culture, right? It creates this cult-like spell that dictates that we need to go on a certain path, right? And this is what is perceived as the right path. And so, and she was successful, so you can understand why she would want to continue that path. But that was a wake-up call for her.
The stress, which causes the inflammation, all the internal things happening, doing that.
Exactly. And when she was diagnosed, the light bulb, she immediately realized that what she was doing was just following what was being dictated by culture and not what her heart. As a child, she knew, right? And so she changed her course, and now she feeds America and the world, actually.